thank you for Claire for the invitation and the opportunity to talk to the group that we have at hand, is really a bit about the health consumers and our community participation in the development of the Healthy Weight Action Plan. This project's pretty dear to my heart in lots of ways. Just to give you a bit of background on me, I'm a nurse initially, then I did postgraduate studies in health promotion and public health. You know, like most West Australians, had to manage my weight and also watched family members and friends struggle, and also when they've been, when their weight has affected their health badly, trying to interact with the health system to find the best path in and the best support. Also worked with a lot of colleagues who have really wanted to help people and also had some problems with finding their way through the system. It's a very tricky, complex issue, is really what it comes down to. So I was fortunate enough to come into the Department of Health about 18 months ago and was put on the project of, it was actually a bariatric project initially, which my colleagues who are on the line as well actually were already doing, their team was already doing some good work in that area. So we had to do a bit of a refocus. So I'll talk to you about the path that took us to developing the Healthy Weight Action Plan. And I'd also like to acknowledge that I've used the pictures throughout this presentation. They're also reflected throughout the actual Healthy Weight Action Plan online of Western Australian health consumers that shared their stories, gave their voice, gave me very concrete and grounded feedback at a number of different opportunities within development of the action plan. I was privileged enough to hear stories, to be pulled up, to be corrected, to be congratulated when I was heading in the right direction. A lot of the consumers also consented to have their photographs taken to be the faces of the Healthy Weight Action Plan, which is something, in all honesty, as a policy officer and having also worked in consumer organisations with diabetes particularly, where type 2 diabetes, there's a lot of stigma around and people often don't want to put their face in front of the condition. I was pretty proud that people felt safe and comfortable in order to do that for our document, and it gave it another level of meaning for me, and also I think really showed a willingness to participate. So where did it all start? Often in health, and my experience within the department is things are developed as a result of a problem. And the problem is often identified by increased ministerials to project officers like me, so people going to their local members and saying, look, why can't I access bariatric surgery, or I really need help and I can't seem to get it. There's also other pressure points in the system. There's rising costs. There is pressure on hospital doors. There's pressure on services, because often with the issue of overweight and obesity, along with it comes many comorbidities which cause people pain and distress and quite ill health. And so that puts pressure points on the system. Clinicians advise us that there's issues and that we need to do some things. And so really in putting this together, we had all of that come together. We had ministerials around bariatric surgery. We had clinicians in the diabetes and endocrine network, the cardiovascular network and the renal network come together and say, we've got a problem here. We have patients that need help, and we need to do something. We need a better plan. We need a strategy. We need services. We need things on the ground. The system needs to reorient. This is what we're seeing. We kind of had grand plans of how we were going to tackle this issue. And so initially the brief I was given was to look at bariatric surgery. What I did was actually went around to colleagues in the department to say, what are you doing? How does it, you know, how far has it progressed? And that's when we discovered another area of the department was working on the bariatric surgery issue and working in a path to find a solution for a different service orientation and numbers and all sorts of things. So that was no longer my brief. But the more I talked to people, the more they kept saying, this really, it's complex, it's complicated. And so this picture is, I call it the spaghetti map. I can share the link to this picture afterwards, which is from Behavioural Insights, which actually just shows how complex the issue of overweight and obesity is. That is affected by media, social media, psychology, the economics, food, activity, infrastructure, biology, medicine. There's so many different bits. And so how do you, can you see my mouse on this? Just Claire, can you see the mouse? Great. So how do you unthread this? You know, if you're just tackling one little box, can you actually make a difference? You know, do you work with people that are tackling the different boxes to make a difference? How do we actually go about this? It was actually completely overwhelming, which is often, I think, as I went through the process, how consumers feel completely overwhelmed. Because the issue isn't as simple as energy in, energy out. It's not as simple as what you eat and how much you move. The more research we did, and we did a background paper to inform what we needed to do, where the psychology around how people get to having multiple chronic conditions, having weight be an issue for them, it's very, very complex, and all of these things interact. So when we went to speak to our colleagues, we were told things like, your plan's too small, make it bigger. You need to include prevention. Actually, you don't need to include prevention because that's not the part of the department you're in. Prevention is being covered in another section. The governing body's too big, but we all want to be involved. So skinny down the governance, but expand it, because we all think we own some of this issue and we want to do something with it. Where are the consumers? We're talking to all the health professionals within the department, other departments, other areas of WA government. But hang on a minute, has anyone actually spoken to a person that has an issue and that's experiencing issues with the services or in community? Where's the consumer voice? We need local government, we need other government agencies, we need carers, we need professionals, we need general practitioners, we need care coordinators, we need academics. At which stage I rocked in a corner for a little while, in all honesty. However, I think it's a complex problem and it's like a puzzle, and I do like puzzles. So I just sat back and looked at it all and went, we could be very overwhelmed by this, and we could then do nothing. We could talk about it a lot, say how very complicated it is, but not do anything. Then we actually spoke to some consumers, and I read some stories, and I had people call me, and I realised to do nothing is not an option. That all of these indicators and these pressure points that we'd seen were real, and we needed to do something. The biggest thing we needed to do was connect. We needed to connect all the parts of the system. And so people then started with the philosophy of, we need to talk more for a start. We need to talk to people, we need to talk to service providers, we need to talk to the researchers, and we need to talk to the policymakers. And so we went back to ask more questions. So the first 12 months was really about gathering information through a consultation and collaborative process and developing collaborative relationships. I went back to my director in the department and said, I don't think this brief is about bariatric surgery. I think it's definitely a big component of this that needs to be worked out. But there is another section of the department and another division who's next door to us that's working on this one. I suggest we work on that with them, and that they are best placed to solve that problem and to worry that nut. And they continue to do a really good job at that and have progressed really well. What I said is, here's what I've heard from people, and I actually think we need a plan. We need a plan to do something, and it needs to be targeted at different levels. It needs to be targeted at system level, at service level, at community level, and at individual level. So there's also no one quick fix here. Although many people wanted, can you give me a program, a widget, something that I can do, or I can give to my patients, or I can refer them to, that's going to fix this problem. Can't do that. If we could, the world over, we would be doing it. But the world over, everybody looks at that spaghetti map and agrees that it's complex. And so agrees the way to deal with complexity is through partnership and collaboration. And each making sure the section of the system, community, or your own space that you are in, you manage to the best of your ability. So that you do the best you can to deliver the best quality, to have the best outcome. And so if each of us are working to that philosophy, then the spaghetti gets a little bit untangled and the journey gets a little bit easier. So in talking to people and in talking to those people, that led us to this journey map that I'm going to show you now. So over 2018 and 19, we had a conversation journey, is probably how I would put it. We started off by doing a service inventory, so sending a survey out to all the service providers, HSPs, anyone and that we thought or knew of that were delivering services or had an interest in delivering services in early intervention and management of weight. That resulted, excuse me, that resulted in feedback from about 96 organisations with about 56 different programs, services, interventions, bits of information that people were giving. And so that gave us a bit of a list and a bit of a look at what was happening. In that inventory, it really highlighted that we were giving out a lot of information, lots of information about diet and physical activity. However, there were also primary care organisations that were delivering services using a mixed model, so which means using multidisciplinary, which is you might have a dietitian, an exercise physiologist and a GP, sometimes a diabetes educator, and that was giving some people some support and some success. But on a whole, we didn't have many long-term intensive behavioural interventions, which is what the literature said was most useful to people. We didn't have anything in peer support, nothing that was structured, that enabled peers to connect with peers, to share experiences, to support each other on the journey. What the literature said was support was incredibly important. Psychological and emotional support was one of the key success factors to most interventions and most attempts at trying. And this is mirrored in a lot of other behavioural areas like smoking. The key to success to quit smoking is actually the number of times you try and how well supported you are. You can have patches and use the quit line, but the key to it is keep at it and keep supported. It's a lifelong journey. This is very similar. So in looking at that, we went, okay, right, we've got a few gaps here. And also there was very little regionally, and it was concentrated in pockets of Western Australia. There was no real services that actually met, or very limited, that met high priority groups, so people that were struggling financially, that had lower education levels, that had less transport, that lived further out, that had multiple chronic conditions which made them very high risk. So that gave us some very key information on kind of what our ground zero was. It was not inclusive of everything. It was a self-report survey, but it showed us some gaps in the system. Then next we went to a partnership with the Health Consumers Council, and actually I must acknowledge the partnership in this project with Health Consumers Council and WAFA was fundamental to the success of this project as well, because it gave us consumer voice, primary care input and the system level health service information. So we spoke with Claire, and that's when I first started working with Claire on this project, and we asked Health Consumers Council if they could help us to reach through to our consumers and find some information and stories. Claire came back and said we could do a survey and we'd like to gather some stories. We'd like to run some focus groups. Would you come and be part of them and talk and present what you want and why you want it and how and the importance of it, and support us. And so I was very privileged to be involved in that, and that started my relationship with a lot of the group. What the survey simply said is weight a weight on your mind? What a powerful question that proved to be. We had the royal we in that Health Consumers Council and the project had a very great response from a number of consumers who simply shared their stories, told us what they had done and what they hadn't done, what worked for them, and also a lot of people agreed to stay involved in the project. So that gave us another key piece of information. And also, I believe that also stemmed off onto our Facebook interest group, which many of you are still part of, and we still have quite a decent membership of that Claire interacts with, and we tend to interact with in the future. So then our Facebook group was established. We started gathering consumer stories through the mechanisms we've just spoken about. We ran some consumer workshops, which I helped facilitate, and included online components to that. And at those workshops, we started to record and gather some stories for what would turn out to be an incredibly powerful and influential strategy. So that led up to the Obesity Summit, or the Obesity Collaborative Summit, in October in 2018, of which we had about 196 people, I think, came together in a room, which was a mixture of consumers, clinicians, health system, policy, local government, anyone who was basically interested and wanted to attend and wanted to talk about the issue of early intervention and management of weight and how we might deal with this spaghetti map. To kick that session off, we had a presentation from Megan Burley, who was the Director of Health Networks, framing why we were in this space and what we wanted to do. We had Chris Kane from WAFA speak from a primary care perspective, and Pip Brennan, the CEO of Health Consumers Council, had a very powerful presentation. The presentation actually shared the stories, showed some videos of people's journeys, struggles and paths and successes sometimes, within the system and outside of the system, and really framed and kept us focused for the discussion on a person-centred approach. So at this time also, my journey was made a little easier because there was something called the Sustainable Health Review, which actually put front and centre that we needed to have patient-centred or consumer-centred care. Also, having come from working in a not-for-profit organisation in the diabetes space, I knew how important the consumer voice was to reshape health. And so the way I worked, consumers were already part of what I did. It wasn't new to me. But it made it easy for me to do this in the department because there was this very strong focus on whatever we do, we need to be patient-centric and consumer-centric. Now, what that means for me is not just sending a survey to our consumers or not having one or two consumers sit at an advisory council, but it's really hearing the stories, really making sure their stories are reflected in what the end product is, and it's user-friendly at the end, which is a pretty tricky balance when you've also got to produce a technical policy document, and was quite a challenge. But I think at the summit, having those three partners speak, giving those three perspectives, then sent us off into discussions about, okay, we had these very powerful stories that focused each person in that room on, okay, this is the issue at hand, what are we going to do about it? And how's that going to work? So from that, we got a lot of information that we had to theme and process and boil down into what we needed. The clear message I got from that day was, please do not give us another overarching motherhood statement policy document that is beautifully constructed, but really what does it do for us as consumers? And so that really hit home for me because I was very challenged by that, because I'm in a system where you write policy. Policy is very important and plays a very important role in shaping what government does, shaping what the end products are, and figuring where we spend our dollars. So policy is important, but then how do I take this information and craft policy, but also create action? So I kept talking, I kept asking, I kept knocking on doors, going, how do I do this? I think it looks like this. Does it look like that? And just kept working with a very good collaborative group of people that provided me with significant guidance and information and knowledge and wisdom, consumers being key to that. The reason how I say that is that when we first, and I was working with a colleague, Whitney, when we first crafted the first document, it was beautifully written for the Department of Health. It ticked all the policy frameworks, but it just didn't sit right because it wasn't action. So I tested it. I asked Claire if we could go back to our consumers. And we also decided that we needed to work with additional people within the department that fund the programs, that craft the contracts, that purchase the services, to make sure that what we had written was actionable, which meant getting a lot of other people on board to move forward with this document. So that was a second round of consultation where we had a strategy workshop or planning workshop in February. We went to an action planning workshop a bit later. This was all happening within a 6-week period. We also did some more consumer feedback at this time with our first draft. So usually what happens with the way you develop policy is you get to this point here where you've done the consultation, then you take the document in-house, you write the policy, and then you do one final quality check with an online consultation, and then you finalise the policy. But what we did here a bit differently is from this space here, we took the information and we processed it, we created our draft, and we actually put it out again here at this time. Where I think the line should, hang on a minute. Yeah, sorry, I've got my slides a bit around the way. So we ran another consumer workshop here as well, where we had our first draft. We actually got some quite constructive feedback in this process that helped us to reshape the final draft and the final product, which then we took out to an online consultation with the second draft, really, at which time we didn't get a lot of changes by that stage. There was minor changes within it then, and then it was going up through all the approvals process. You can see that takes a little bit of time, and then in November the Minister for Health announced that the action plan was born, and it was very deliberately called an action plan for a number of different reasons. So, and this is what it looks like, and you'll see online. And again, even the look and feel of it was quite different to a normal policy document. So that's kind of where we went with that. Is there any questions anyone wanted to ask currently, or are we heading in the right direction? Claire, are you hearing anything on the chat?
I'm not seeing any questions on the chat yet, but we can.
Great.
Yeah.
Okay. So the next bit is, so the Healthy Weight Action Plan was born, and this one is actually the vision for the action plan was generated by the community, and then these areas of action were put into place. This framework for action was born. So we wanted to connect better, change how we talked about weight, because stigma was a huge element for people coming forward to talk about their weight, to ask for assistance, and also health professionals really struggled with how to bring the topic up. But then what the research says is health professionals feel uncomfortable, people feel uncomfortable, but actually both wanted to talk about it. So that actually was, okay, we need to do something about that. We need some training for health professionals, and we need to actually start looking at the issue of stigmatisation of weight and how we present it in the media, how we talk about it, all sorts of different things. We need better access and care coordination. We need to build workforce capability and confidence. And with workforce, we need a medical workforce, an allied health workforce, and a peer workforce, and a community workforce in order to tackle this topic. We need quality improvement. We need to make sure what we are delivering is to best practice and hits the mark each time. We need room for innovation. There's new stuff coming all the time. And we need to empower the community to take action. So we need to find ways to connect community that are already doing great things and to grow that support. We also recognise, and so under each of these action areas, strategy areas, there's a number of actions which you can see within the plan. We also realise that there's some critical building blocks to enable this, this work to happen. We need collective action, shared measures and transparency, action at all levels, right at the beginning I spoke about system, service, consumer. We need it at all levels. We need it at community. We need it across government. But that's actually quite hard because it's not really a sexy topic, and it's hard to talk about. So we've got to do quite a bit of work there. We need engagement and partnerships and culture and leadership. We need shared aspirations. We need to build trust. We need adaptable governance. We need funding and investment, and we need strategic learning and systems thinking. Now, all of these are quite big words and can mean a number of different things, but what we need to do is we need to use these principles and building blocks in whatever we do going forward. We need to kind of walk the walk of what the document tells us to do. So that leads me to what action is currently underway. So within this time, we had some changes over in staff. I actually went off and did something different, then came back again. I had the opportunity to come back to this project, which I am very thankful for, because it is close to my heart and I really enjoy working on it and I'm passionate about it. And so what it enabled us to do in the time was actually look at, so it's for 5 years, the plan. So in this first year, what are we going to do? It was really important to make sure that we start things off with some infrastructure that supports ongoing collaboration and engagement with health consumers. So Department of Health have been able to provide some ongoing funding to the Health Consumers Council to keep very important consumer involvement and explore mechanisms going forward for best involvement into this project and into this project of work. We've also funded Diabetes WA with a proof of concept for a total meal replacement program, which is based on some science out of the UK, which is around very low calorie diet restricted total meal replacement, but adding the supports of some counselling and some behavioural support ongoing in order to kickstart a weight loss journey, to see how that works within the system and how it works for people. We are working with Curtin University to create a quality criteria and an outcomes-based framework. That's a partnership project with WAFA. Actually, the one above is a partnership project with WAFA as well, where we are looking at quality standards for what should a good healthy lifestyle program look like. What are the key components? And then when we commission or purchase, we will purchase according to those criteria to make sure we can ensure consistent quality in different types of programs and services across with what we're delivering. We're working with East Metro around a media guide, which is looking at the issue of stigma and how we can minimise that. So that's a very exciting project with our colleagues in East Metro. East Metro also doing a workforce development project, which is around a MOOC, which is an online course basically, which looks at overweight and the Australian Dietary Guidelines. That's being used as an early intervention or a brief intervention for people and being tested in that way, but also it's actually being used by East Metro to help their staff and their workforce be able to talk about the issue of weight with patients and also then have something to refer them to. So what we've funded in this first year, or started working on in this first year from the Department of Health's perspective, is some infrastructure things, some things on the ground to test out with consumers, and really keeping the mechanism there for that continued collaboration. We'll also be pulling together one of the actions, one of the first ones is to develop the WA Obesity Collaborative, which is a much broader partnership allowing more people in the door. Over the next year, the structure and function of that will be broadened to enable the conversation to be more broadly across Western Australia around the issue of weight. So in our next steps, there are a lot of opportunities for continued consumer engagement and involvement. Health Consumers Council, of course, is one avenue for that, and a structured one we have within the partnership agreement. We also have a continued partnership with WAFA where we meet regularly to understand what each other's doing and how we can cross-pollinate and connect, really keeping that connection up. WAFA is doing a lot of work in the general practice space and have a project team also dedicated to this as well. As we go through in structuring the collaborative and developing different project elements, there'll be opportunities where we would like consumer feedback and input into how we go going forward. And then that's pretty much it from me. But this is kind of a nice quote at the end. And it is true. If we just wanted to get a policy document done, we probably could have done it 6 months earlier. We probably could have had a lovely, shiny, beautiful policy document. But it took us longer. It was a bit harder. The journey was a lot more windy, but highly, highly valued and valuable in terms of what we ended up with in the end. We ended up with something that a few of the consumer representatives that supported the process, and actually I found really personally supported me to be brave, to go, okay, let's just push it this little bit further to see if we can structure it a bit differently, or we've taken this action out. A couple of people said, this one's missing. Why is this action missing? It needs to go back in. And that gave me license to do that, because I could say, look, this has been recommended and our consumer input is incredibly important, and this is really important, it needs to go back in. Yes, it's a hard one to do, and I'm not sure how we're going to do it, but it needs to go in the document. And so that gave me incredible power to be able to go back and reflect to my leadership, this is why this one's in. When they said to me, well, how are you going to do that, Helen? How's the system going to do that? And I said, I don't know, but we've got to put it in there, because then we keep thinking about it and we're going to keep trying to work towards it, because it's clearly a fundamentally important thing. Because what shows me that is the evidence shows me that, the consultation confirmed it, and the consumers confirmed it. So we can't not put it in because it's hard. We have to actually figure out how we do it. We won't have the solution straight away. This is that complex spaghetti map. One area is not going to solve it, but we have to start pulling together and working together to do it. So I think we have started down a path where I think we are continuing to connect. There's a very big willingness across the Department of Health, across WAFA, across service providers to actually work on this issue together. There's some very talented people working in the area that I'm privileged to work with, including our consumers, who really do inform and are at the front of mind of what we do, and I think are an important part going forward. Open to any questions if anyone's got any. Hopefully I've gone all right for time, Claire.
Yep, great. That's great. Thanks, Helen. And what we might do is I'll invite you to stop sharing your screen just now, and we'll go back to the gallery view. So again, just a reminder, if people are joining us, you can have your screen set up so that you can see the person who's speaking, and that's what's called speaker view, or you can have the screen where you see everybody speaking, and that's called gallery view. And the way you change that is in the top right hand corner of your screen. So thank you very much, Helen. While we're still recording it, I'll just add a little bit from Health Consumers Council point of view, and then open it up for questions. We've had a few comments on the chat. Health Consumers Council is delighted that we have been able to continue working with the Health Department and WAFA on this, and we are planning to be able to recruit initially a relatively small consumer advisory group specifically looking at this area, so that can then inform and have input into the design and the next steps on other projects that consumer input might be sought on. And we've just had confirmation from the department about the resources that would be available to us to support that consumer participation, which is great, and so we will be making progress soon. We'll also be able, fortunately, to recruit a person to work with us on this, so we'll be able to dedicate a bit of staff time to this position. So that's really great, and I'm personally very excited about it. I think it's a really ambitious plan, and I would echo that, having worked at the Health Department and having worked at WAFA, I do think that this plan is a great combination of those organisations working together, and is a bit different from the norm. And I think that it was wonderful that consumer input was able to be used along the way, and I think that we're really excited about the possibility of that continuing going forward. Just a couple of things that I'm most excited about the plan, because I just wanted to draw a few things to people's attention. As Helen said, under that first one about connecting better, there is the plan is to put together an obesity collaborative, like Helen outlined. Under the one around changing how we talk about weight, there is already, you know, I'm really interested to get some consumer initiated discussions in this space about what that actually means. I know that there will be lots of people who've had experience in this space, and it would be really great to start to kind of almost like crowdsource what information is already out there about some of the evidence. But I think this is one of the areas that evidence seems quite hard to gather, and so it would be really great for us to have some crowdsourcing about how we might go about that. The other things that I think are going to be a little bit more tricky, just you know, from where I can see how the plan is, that they are going to involve lots of people having to work together in new ways, is some of the ones around the integrated model of care. You know, there's going to have to be actually a fair bit of work for everybody who's already in the system to kind of maybe let go of some ways of working, and actually, you know, I think sometimes from my experience in large scale change, that it can sometimes be that everybody wants everybody else to change because they want their part of the change to be the thing that everybody else adopts. But also, I think in this process there's going to be quite a lot of all of us involved, be that consumers, be that staff, be that clinicians and policymakers, all of us being open to, okay, how are we going to be changed in this process? And I think the opportunity to have consumer voices inputting into the quality standards and the outcome frameworks, that's a really foundational piece of work, which I think is pretty exciting. So watch this space. I have put a couple of links in the chat there to, if you want to join the mailing list and you're not already on that, we will be ramping up how much more information we're able to send out to that soon. And we will be advertising, like I say, we need to have an initial discussion really even about scoping how that consumer advisory group is going to look. So I'm going to stop the recording now and we will go to questions. So thank you, Helen, for your presentation.